Welcome to the Dr. Ramsey Show, sponsored by Revitalize Functional Medicine. If you're looking for health tips released consistently every week, you've showed up to the right place. We're grateful that you're joining us, and now your host, Dr. Teresa Ramsey.
Hello and welcome back to the Dr. Ramsey Show. Today is just going to be me. I've had a lot of questions from patients in particular about, how I got to this place in my career. What is it that I love so much about it? Because it's obvious that I really love my work. So when I started out with my career as a young woman, I was a nurse and I loved being a nurse. I predominantly worked in heart surgery, ER and ICU, and I traveled. I did traveling nursing, which is fascinating because I had a suitcase and a bike and I just traveled from city to city, learning the new, the hospitals, etc., and really loved it. So when I settled down back here, I came back to Arizona. I settled down. I just got a job, no more traveling nursing, and I really enjoyed it. Again, I wasn't looking for anything else. I worked 312s. There's not much better than that. Great benefits, etc. And then one day, and this story is interesting. I was working with one of my ICU patients, and usually patients leave quickly. We extubate them and they're out. But there wasn't a bed available for this older lady, and she was by herself and she was scared. And I was going over her discharge instructions. I was sitting on her bed with her, and I was going over all of the discharge instructions. My head nurse walked by, and she called me into her office. So I thought, I shouldn't be sitting on a patient's bed, or something like that. I didn't know. And she called me in, and this is what she said to me. She said, "Are you doing what you love?" And I said, "I am. I truly love my job." And she said, "Well, you love people. You're great with people, but your patients are always asleep. I would think that you'd want to interact with, your patients more." And I thought that she had a good point. I never even really thought about that. And I immediately just started looking for other complementary jobs like nutrition, maybe massage, where I'm actually talking and working with people. And the first place that I called was SCNM, Southwest College of Naturopathic Medicine. And I spoke to, and I remember her name, Debbie Smolinski, for about 30 minutes. Once I heard that was just a program to become a doctor, I didn't want that. I never wanted to become a doctor, never had that interest. But because she was so kind and because she talked to me for so long, she sent me a package, which I wasn't even going to open. I really was not interested. It was my husband at the time who did. And he told me, "You would really love this school. Like, it's everything that you stand for." So I went on my interview to go into the school, and I totally thought that I blew the interview. So I was with this physician, I can't remember his name, and he asks me what I would do if I don't get into this class, this first graduating class. I said, "I'll probably go look at nutrition or acupuncture or something like that." And he took his fist and he slammed the desk and he stood up and he said, "Young lady, what I'm asking you is, how committed are you to this field?" I said, "I don't know what this field is." And he didn't really like that, but I truly didn't know. And it was a whole-day interview. And at the end of the day, I thought I blew it. But then I got a phone call to see if I would be willing to join their first graduating class as a student. And I think the reason they asked me was because I did have a good nursing background. And I believe from the first graduating class, there's maybe 5 or 6 of us still practicing, maybe a little bit more, because, the first year of schooling isn't that easy, when it's a brand new school. So I'm in practice, and actually before practice, I'm going back and forth because when I was trained as a nurse, we were taught to cut out and suppress. Like, that's how you help people, is you cut out their illness or you suppress it with a drug. There's no supporting. There's nothing like that in conventional medicine. I didn't learn that. I didn't even learn about nutrition as a nurse. So now I'm learning we can help the body heal. We can prevent, illnesses. We can improve our quality of life and all of these things that I never really learned. The first thing was how inflammatory sugar was. And the first thing I did was put 3 tablespoons of sugar in my coffee every morning since I was, 10 years old. So I had some habits to break. And the more I learned, the more I liked it. I really wasn't convinced, though, until I got to clinicals. And when you're in clinicals, you actually see the magic of your medicine. You see people getting better, like I never thought was possible. And so I was hooked. And then when I graduated, I started my practice. I was basically being a general practitioner until women were flooding my office with Suzanne Summers' books about taking hormones in menopause, which I maybe had 3 days of hormone replacement therapy in school, in med school. I don't think they teach that very much in any med school. And so I was on the hunt to learn this stuff. So I went to Suzanne Summers' doctor, and I studied for a year with her, and that was terrific. It just really showed me things I didn't know about hormone replacement therapy. The next year, I got this email, and the email was about my teacher who I currently study, Dr. Neil Rouzier. The reason I love studying with him is because he only teaches with the research. There's no opinions. It's like, this is the fact. This is how people do. When you don't have hormones, this is what happens when you give them. This is what happens. And it was just like this light bulb went off in my head. And to this day, that has been my baby. My practice does mimic exactly what the literature says about prevention and quality of life. And I prescribe quite strongly. I think that's the best word I could use. It took pharmacists a little bit of time to get used to how I prescribe, because most doctors don't use oral estradiol. They're afraid of it, which I'm not afraid of it at all. The reason that most doctors are afraid is they think that it increased risks like strokes, heart attack, and blood clots, which, yes, synthetic estrogen did do that. But bioidentical estradiol has not once caused one blood clot, one stroke, or one heart attack in any study to date or any patient to date. So I do use oral estradiol whenever I possibly can. And the reason is it prevents heart disease and dementia, where topical estrogen, which is a patch, a pellet, a cream, a suppository, does not protect heart disease and dementia. Only oral estradiol does. And it reduces it by 85%, which is quite nice. So you can see why, I love this. You can see that, yes, I do things a little bit differently, but my training is strong in literature. There's no, room for guessing in my practice. And again, my patients do great, just like the research says they should. And, I think the hardest thing is, for my teacher, for me, and for those of us who have such passion, is what we do. Being a specialist in bioidentical hormone replacement therapy is not recognized by the FDA. If it were, people would get better help. Like, women would know where to go for their hormones. Men would know where to go for their hormones, instead of urologists and GYNs who study surgery. They don't really study hormone replacement therapy. And I see this all the time. And just last week, even today, my gosh, I've been in practice since 1996. And, bioidentical progesterone is the most safe thing a woman could take, period. It's the most unsafe thing a man could take. But for a female, the safest thing, any age, any quantity. However, last week, one of my patients said her gynecologist said, get off of that progesterone because it's so risky. She's talking about synthetic progestin. And I hear this every day. And they're opposite cellular reactions, but they do lock into the same receptor. And I know I'm sharing with you my journey, and now I'm kind of like talking about my specialty because I love it so much. I'm so glad I got here. Like, I know it was a God-given path because I didn't know it even existed. It certainly blessed my life. I think I've shared, and I'll be brief in the fact that I always thought that I was a high candidate for breast cancer. And now with the progesterone I take, my risks are significantly reduced. And so that gives me pride and joy as well. The journey continues. I don't see myself going anywhere anytime soon. My book is coming out soon. I'll be getting it back from the editor and I'll go to print. And that's called The Hormone Book. And it's referencing all of the articles that I use when I'm working with patients, so that everything's reference-based instead of opinion-based in my book. So it was an interesting journey going from a nurse to a physician that I never wanted to be, especially a functional medical practitioner, but it's truly rewarding in every aspect of the way. So thank you for listening to my story. I'm happy to answer any of your questions. I'm an open book. So reach out if you need anything else from me, and I hope you have a wonderful rest of your day. Thank you for listening. Bye-bye.
Thank you for joining us, and stay tuned for our episode next Tuesday. Stay healthy and happy. Until next time.